Hi, my name's Carol Roberts. I'm one of the psychosexual psychotherapists at Share Psychosexual Service, and the purpose of today's video is just a brief overview for you as potential service users around a client and therapist agreement that we look at before we start therapy. Psychosexual therapists are bound by the Code of Ethics of the College of Sex and Relationship Therapists, otherwise known as COSRAT, and one of the key policies within the organisation is that we complete a client-therapist agreement at the start of therapy. You could, in fact, call it a contract or an agreement. And the purpose of this is that we have a written understanding between us as client and therapist before we start therapy, so that we have a foundation that we can then use to do our work with. It's important from the COSRAT perspective that the client-therapist agreement is a mandatory document, that it's not just a verbal agreement, but actually it's written down so that you've got an opportunity as the client to revisit this contract at any time to make sure that you're happy with it as you go through the therapeutic process. Having it written down also stops any misunderstanding. It also helps you to retain the information and not forget your roles and responsibilities that you've agreed with when you first come into therapy. It's mutual agreement. It's an agreement that we have formatted, but that you can have a discussion with your therapist before signing, because obviously you've got to be happy with the content if you're going to sign that you agree all the different elements that we capture in it. It also provides a way for us as a service to gain your informed consent to engage with us in a therapeutic setting. So if you agree with the content, you are consenting as part of that to being in therapy with us to address the problems that you've been referred in with. We will sign the therapeutic contract, so the therapist will sign it, you'll sign it, and then we'll both keep a copy. In the service, we keep a copy on your electronic records, and you take a paper copy home with you for your own records. So now I'm going to talk you through the client-therapist agreement, or contract if you prefer to call it that. The document itself is also on our website under the leaflet section, and as I talk through each section in this agreement, you'll be able to see it on your screen and you'll be able to read it as I talk. Because it's on your screen, obviously if you want to pause the video at any time to concentrate on a section more, then please feel free, and then just pick it back up again as we work our way through. I'm dividing up the agreement into the sections as it is on the document itself, and I'll give you an overview of each section as we go through. You'll see at the top of this page, which is the first page of the agreement, there is something that refers to a PB or a PBP number. Your PB number is your individual number that we use in the service, and all that PB stands for, it's nothing special, it just means Psychosexual Blackpool, because we work under Blackpool Teaching Hospitals Trust. A PBP would be if a partner were to come with you, so that just means Psychosexual Blackpool partner, and you both have the same number, you just have a slightly different letters at the beginning. Obviously then your name would be there, or you and your partner's name if appropriate, and also it tells you who your therapist is going to be, so the therapist that has been allocated to you for your term in service while you're receiving therapy, so that you've got a reference point and you have that person's name to keep with you at all times. The first section that you're reading at the moment is around attendance, and we know from research that the more that people engage in psychosexual therapy, the more benefits that you will receive from your work in your time in the service. We are actually commissioned for 10 routine appointments of therapy, but interestingly, lots of people don't need 10 appointments. Some people need slightly more, and that's something that your therapist will arrange if that's the case once they have started to work with you and as you're getting to your 10 appointments. This won't be offered to everybody. It is agreed with you on a case-by-case basis, and it will be clinical judgment of your therapist to decide whether or not any couple more additional sessions would be of benefit to you or not. While we're talking about attendance, it's really important that if you book your appointment, that you commit to attending to that appointment. And the reason for this is that a wasted appointment can cost £125. So if we have a therapist waiting for you to attend and you don't turn up, that's a lot of money wasted and can cost the NHS a significant amount if you added up all the failed to attends in all services across. The service does have a policy for cancellations and appointments that are failed to attend, and in some occasions if there is a pattern of repeated appointments that are booked but not attended, it could well be that you are automatically discharged from the service and your referrer will be notified. If at that point you come back into the service, you're referred back, you will be placed at the bottom of the waiting list. You won't be able to go back in straight away to see your therapist because your slot for therapy will have been taken up by somebody else. And that's because there is a demand on the service, and we do have waiting lists for people to come in and see our therapists. The service doesn't accept self-referrals, so if you are discharged from the service at any point, you would need another referral to come back in and see us. If we need to cancel your appointment, because sometimes it can occur the other way around, then we will give you as much notice as possible, and we will rearrange your appointment as quickly as we can do, so that there's no impact on the therapy that you're receiving and the care that you're being given. So that's the section on attendance, and once you've read that, if you have a little look at the bottom of this page, there's a box with agree and do not agree, and it very clearly for this section says we understand that cancel or fail to attend policy as the points above, and you would just put a circle around whether you agree or disagree with what is being said. If you disagree with this, then that's a further discussion for you to have with your therapist, because this may impact on therapy going forward. Section 2 of the therapy agreement or therapy contract, depending on how you want to call it, is about your appointments themselves. The team will organise that you're being seen in a safe, confidential and undisturbed environment, so that you can actually feel safe and comfortable talking about issues of intimacy and issues that are very private and confidential to you. Each appointment is 50 minutes in length as a maximum, so that's 50 minutes. So your appointment length is quite substantial, and it's really important that we can get the appointment off to a start at the time that you're booked in for. Now, on occasions, this might be compromised, so you might be running very, very slightly late. If that's the case, please ring the service and just let us know. Or it could be actually that your therapist has been held up with their appointment before. There may have been an issue that's too urgent to disregard or not action at that point. So there may be a slight delay. But on the whole, we like the appointments to start very, very punctually, and also to finish punctually as well. We operate everything in the psychosexual service from our base in Accrington, although we cover the whole of Lancashire and Blackpool. We are a single point of access, that's what we call it, where all our telephone calls come through to our service office in Accrington. And if you look on the page now, you'll be able to see our office contact telephone numbers. We have a dedicated landline, we also have a dedicated service mobile. both of which you can leave a confidential voicemail, or indeed you can send us a text, and those are the best ways to contact us. So if somebody doesn't pick up the phone when you ring, please leave us a message and we will attend to it as soon as somebody's back in the office. If you do send a text or leave a voicemail, please remember to tell us who you are. So just put your name on it so that we can very quickly track down your appointment on the system and we can manage any issues that are going on. Also, during appointments, it's really important that you are present to have your appointment with your therapist. In that, I mean that you are able to focus on that time with your therapist, because that way you'll get the most out of it. And for that reason, we have restrictions that we need agreeing, that all mobile phones are turned off and not accessed during your appointments. And that's not just about you as the client, but the therapist wouldn't have their mobile phones on when they're having an appointment with you. We also have to agree that there is no alcohol or drugs being used just before the appointment, so that you can really be in the room, be able to concentrate and focus. And alcohol and drug use might prevent you from being able to do that. Additionally, we wouldn't hold a session if you arrived with any children, even if these are small babies, because it's not appropriate for two reasons to have children in a psychosexual therapy session. One, because having children and babies in the room are distracting, and two, because actually we're going to be talking about things of very sexual nature that aren't appropriate for children to hear or be witness to. Also, in my experience, I've had times when service users have turned up with a dog to their session, and again, for a couple of reasons, it's not appropriate to bring pets to your appointments, because for two reasons really. One, they're distracting, and two, you are going to be in a health setting, and therefore infection prevention and control is really important. So unless the dog is an aid dog for somebody who has some visual impairment or some disability that requires having a care dog with them, we wouldn't hold a session if you came with an animal. During the COVID-19 situation, we have started using video appointments for some clients during therapy. This isn't an expectation for all of our service users. It's not suitable in some cases, either from the perspective of the therapist, but also it could well be that you don't have privacy outside a health setting where you can go on a phone or a laptop to have a video appointment. All first appointments are face-to-face in venue, and this is one of the reasons you've been asked to look at this video today before you attend that initial appointment with your therapist. It will then be a discussion between yourself and your therapist as to how your therapist might look going forward, and whether or not you go on to use video. If you are using video, it's really important, and this section talks about the importance of you having privacy in the place that you are conducting that video appointment. So you need to have some privacy to be able to do that, and that's not just about having a room in your house where you're on your own, but it's having a room in your house where you're not listening to somebody coming upstairs or being fearful that somebody's just going to walk into the room that you're using, so that you can relax and work with your therapist. It's really important again that appointment times are maintained, that both parties, both yourself and your therapist, arrive at a time that is set. And also, if you are having a video appointment at home, it's really important that you attend for that appointment suitably dressed, ready for the session, and able to focus on the appointment just as you would do if you were coming to a health centre to meet with your therapist. Under no circumstances, and this is really important, must you record any video appointment with your therapist. And this section will capture that you agree or you do not agree to any of the points that we've just talked about. The next section talks about contacting the service or your therapist outside your appointments. So we've already established that we've got a really good safe place for your appointments to take place, so that you can work with your therapist. And it's really important in therapy that we have some boundaries, and we've already talked about those boundaries of having privacy and space and being available for your session. Between sessions, to maintain your privacy, if you bump into your therapist, for example, while you're doing your weekly shop, please be reassured that your therapist will not automatically come over and talk to you or actually acknowledge that they know you. They won't do that, because what they wouldn't want to do if you were with family or family members or friends who were completely unaware that you were having therapy, they wouldn't want then for that other person to say to you, who was that? What, you know, how do you know that person? That actually your privacy is maintained. So if you do bump into each other outside therapy, the therapist will not enter into conversation with you. All contact with the service or your therapist has to come through those two numbers that we looked at before. And in this section, contact outside of sessions, those numbers are there again for you, so you've got them. Under no circumstances must you try and contact your therapist outside of the service. And that could be by any other means, whether you look at personal business and you get a telephone contact number, or that you try and email them privately, or you try and contact them on social media. These break all the boundaries of therapy, and your therapist would not respond to you in any of those situations. So this section will ask whether you understand the restrictions to contact outside of sessions and whether you agree to that or you do not agree to that. The next section is really important because this talks about how we deal with any information that you share with us and about confidentiality. Your therapist will go through our confidentiality processes with you when you meet with them in your appointment, because this is really important. If you don't understand confidentiality, you're not going to be able to engage safely with your therapist, because you'll be perhaps wondering where that information is going to go and where that information is going to be shared. So we do take notes that we record as consultations at the end of our sessions, and we keep these on an electronic computer system that it doesn't find its way into your hospital records or your GP records. It's purely for the psychosexual service, and it's kept within a computer system that's designed purely for sexual health services. Information shared with you in your appointment is strictly confidential. However, there are a few exceptions to that rule. So if your therapist has any concerns that you or someone else is going to be harmed, they have to do something about that. So if there is any risk to yourself, to the general public, or to another person, we will act on that information. So confidentiality must be also broken for other reasons, for example, the COVID contact tracing, and we'll talk about that in the last section of this agreement in a little bit more detail. The therapist, as part of our work and development, we have something called supervision, where we meet another psychosexual therapist and we discuss our clients, our caseloads, and what might be being brought into the therapy room and discussed. This may include your case, it may not do, but the information is bound by the conduct of confidentiality that we've talked about, and the other therapist that is engaging with that supervision is also bound by the same confidentiality rules, so that information remains very, very private. If your therapist writes letters about you and about your case, They will be very careful about the information that they share in that, and actually only capture the content that is relevant to the information that they want to share with your referrer. They won't go into all the detail around your sexual preferences and intimacy that you may have discussed in the sessions, and you will always be offered a copy of that letter so that you have that for your own records if you want it. Or indeed, sometimes we work with our clients so that we put that letter together at the same time as a piece of work, so that we can be confident that the information that's being shared is acceptable to you. It's really important when we are talking about letter writing and information and the way we manage your information that you make sure that you keep us on board about any changes in your address, telephone number or GP while you're in our care. And actually at the beginning of every appointment and every time you ring the service, you will be asked for your address, postcode, date of birth, and we will check that we've got the right GP on the system as well. And that's to prevent any mistakes being made if we're sending letters out. We keep your records electronically as per the trust policies, and we retain your records for a certain number of years, as we are told to do. If you attend therapy as a couple, it's really important that your individual records are about both of you in the session, so the information captured is captured separately but is cross-referenced about that session that you've both just attended. So what is your therapist writing about you? And it's really important that you have access to your records if you want them, particularly while you're in our care. So if you felt like you wanted to have an understanding about what information has been captured, that's a discussion for you to have with your therapist, and that information can be talked about in your therapy session. Once you've left the service, however, it's slightly different. If you want access to any health records, there is a process that you need to go through, and the information that you're looking at currently on the screen talks about a team within the trust called the Data Access Team, and the telephone number is there. You would just contact that telephone number and you would talk to them about what information you required and why. So if we're seeing you with your partner, so in effect you as a couple are the client, it's not either or of you, it's really important that you understand that one person can't request that information without the other person's permission. So your partner would also need to agree that that information about you as a couple in a relationship is being shared. A really important part of this agreement that we're talking about today is about something called the Therapeutic Alliance, and that all sounds a bit wordy, but basically what it means is that we have agreed to provide you with respect and non-judgment while you're with us in therapy. And the flip of that is that we, as your providers, as your therapists, as your service that you're using, that we would expect the same type of treatment coming from you to us. We do have a right, as any NHS service has, to end therapy if there is any threat to either the service or to the therapist individually. And the threat might be a physical threat, but also it might be a psychological threat whereby the therapist is constantly worrying and being upset about something that's happened in the therapy room. This is something that's really important, and we strive to show you the behaviours that we would like to be received from you while you're engaging with the service. Finally, we've recently added this section to the contract agreement, and that's about the COVID-19 contact tracing when you have come into the venue to have a face-to-face appointment with your therapist. If, for example, your therapist is tested positive for COVID-19, we will be required to share with us our recent contacts. In the same way, if you're tested positive and you're asked for your recent contacts through the contact tracing system, you would need to share that you'd spent 50 minutes in a health setting with your therapist. Now, this is a justifiable change in confidentiality, because actually the contact tracing is really important for public health and public interest. We would only be sharing, and we would expect that you would only be sharing, our names and a contact telephone number. We wouldn't be sharing where we met with you or the purpose of that visit. And also, if it were to be the case that one of our therapists tested positive and we were asked to share that information, we would actually contact you first and just have that discussion so that you can talk about it with the therapist. But there would be absolutely no requirement that we would have to share how you've met with this other person. So the fact that you're in therapy won't come into that scenario at all, and you don't have to worry about any of your confidentiality being breached. That's the end of the agreement that we have, and if you just have a look at the bottom now, you'll have gone through, when you see a therapist, you'll circle whether you agree or do not agree to any of the sections that we've talked about. If there are any that you don't agree with, like I said earlier, that will be a further discussion for you and your therapist to have. And then once all of that's been agreed, there is space for you to sign the contract, for your partner to sign it also if your partner's attending, and then for the therapist to also sign it. You will be given a copy to keep, and a copy will be kept on your records. And if you have any further questions about this before you start therapy, you can ring the service on one of the numbers that we've shown you on this document and ask to speak to somebody to go through it a little bit more with you, or indeed you can wait until you meet with your therapist and you can have further conversation about anything that you might not be clear on or anything that's particularly concerning you. I hope you found that useful, and don't forget, if you want to go through this again, you can either do this by going back through the video and just listening to it or reading it, or go into the leaflet section and you can find a copy of it there that you could actually print off if you felt that would be useful before your appointment.